Hi, my name is Cecilia Wining, and I am an occupational health nurse for a paper manufacturing company in the Southwest region of the United States. Today I'm going to talk about the concept application project within the healthcare delivery system. The paper tissue manufacturer company that I work for is a microsystem that consists of 242 employees. For company and employee confidentiality purposes, we will call this company Tissue Manufacturer, or TM, throughout the slides. When occupational injuries occur, it is important to have trained staff on board to evaluate and tend to the injured employee. Listed below are 3 emergency focuses that took place in a real-life occupational burn injury that occurred within the TM facility. Those 3 emergency focuses were protecting injured employee from further injury, evaluating their injury and providing first aid, and seeking advanced medical care. How does leadership fit into the microsystem model? TM works with applying ethical leadership skills within the workforce. Such leadership styles or skills build concern of well-being and trusting relationships. In the case of our burn employee, the team lead was contacted by the staff. The team lead used his leadership and emergency preparedness skills to manage the situation. He assessed the employee, he removed them from further harm, he applied first aid, and he contacted advanced team. Again, the occupational health nurse, the safety manager, and human resources. The team lead immediately coordinated an organizational support team by assigning roles to other employees. Such team dynamics consist of one person was assigned to assist in getting the injured employee to the safe location, assisted in injury assessment, and with the first aid care. And again, contacted the safety team, which consists of the occupational health nurse, safety lead, and human resources. Patient focus and staff focus. TM uses leadership and self-efficacy systems to achieve the desired health outcome of the injured employee. With the assistance of the occupational health nurse, it was determined that the injured employee had received first and second degrees to multiple areas of his body. The next step was to immediately seek advanced medical care. Within the leadership and team dynamics, decisions were made with coordinating next level immediate care. These decisions included factors such as monitoring the injured employee for further complications, protecting the burn areas from further harm, the mode of transportation to seek advanced medical care, and contacting the employee's personal contacts. Interdependence of care team. With the collaboration of all the team members on shift that day, they individually took a vital role in administering immediate care for the injured employee, as well as managing the operations of the company. Studies have shown that by incorporating the belief of one's ability to execute courses of action in any given situation or task can result in positive outcomes. The use of information and healthcare technology. By TM applying emergency preparedness programs into their microsystem, everyone within their workforce can utilize the same learned skills in emergency situations. Policy and procedures are set in place, such as knowing who and how to contact for help, having first aid stations with essential equipment and supplies, and knowing where they're located, such as emergency kit, AED, oxygen, backboard, and a wheelchair. The process for healthcare delivery improvement. By having a positive safety perceptions amongst the workforce can reduce the number of injuries. With continuous education and emergency drills, the workforce can be better prepared and obtain increased knowledge to improve the well-being of an injured employee. Such education or drills can be provided in CPR, AED, first aid refresher courses, including emergency scenario discussions into daily employee meetings, and having quarterly emergency drills. Staff performance patterns. As the TM safety team further investigated the scenario of the injured burn employee, some important details of the care performed were brought to the table. First question was, what worked well? Team Dynamics contacted the team lead. They placed the injured employee in a safe place. They gave first aid treatment per the burn injury protocol, and they worked well as a team. Now let's take a look at some things that may need improvement. One person should have been directed to retrieve the emergency kit. Another person should have been directed to retrieve the AED. One question that came upon was should have the injured employee been taken to the emergency department prior to the occupational health assessment? Specific aspect targeted for improvement. Looking at the scenario and determining areas for improvement, we chose to look further into the fact that the emergency kit and AED were not retrieved. These are two crucial items to have during an injury emergency situation. Personal protective equipment could have been obtained from the emergency kit, such as gloves. Non-adhesive gauze and a burn blanket could have been used to protect the burns and keep the injured employee from going into shock. The AED could have been readily available in case of the injured employee going into an unconscious state. Leading the plan for healthcare delivery improvement. By having a planned purpose and approach, which in this case would be teaching the importance of obtaining the emergency kit and AED during emergency injuries, will help set goals and objectives to healthcare delivery improvement within our workforce. Presenting project plan to staff, including emergency scenarios into weekly staff meetings with Q&A sessions, staff interaction, coordinating emergency drills, and offering brown bag lunch safety workshops, and sharing safety newsletters and statistic information on wellness bulletin media systems. Thank you, and I hope that you have enjoyed this presentation.